So we'll start with the oxygen administration procedure today. So basically what is oxygen means? Oxygen is a gas which is mainly present in the atmosphere. That is 21% of the total gas is only of all about for oxygen. And whenever we are giving it artificially or by any other method, that is known as oxygen administration. So mainly the indications for giving oxygen is hypoxia, and whenever the patient is feeling breathlessness or the patient is having difficulty in breathing, those are the times when we need to give oxygen to our patients. So you can give oxygen by various methods, like we can have a wall mount oxygen, you can give it through oxygen concentrators, and you can give it through oxygen cylinder also. So like basically we'll deal with the things like we have different methods of giving oxygen. So today I'm going to deal with how many liters of oxygen you can give with which kind of method. So starting with the number one method, that is known as nasal cannula or the nasal prongs. So generally the most common method of giving oxygen is nasal cannula or the nasal prong, and initially we'll start with the 1 liter of oxygen and we can give up to 6 liters of oxygen per minute through nasal cannula. After nasal cannula, you can go with the simple mask. Everybody has seen that mask. So that is a mask, and that mask we will connect it with the oxygen source. It can be a cylinder, it can be a concentrator, and with this mask you can give 5 to 12 liters of oxygen per minute. After the simple mask, we can have a partial rebreather mask, or we can have a non-rebreather mask. So these are the masks which will have a reservoir connected with them, and this partial rebreather mask you can give around 8 to 10 liters of oxygen per minute. Same with the non-rebreather mask. With this you can give 8 to 15 liters of oxygen per minute. Then we have another method of giving oxygen, that is known as Venturi Mask. And the Venturi Mask, according to the color coding, we can decide the liter and the concentration of oxygen. So we have different color coding for the Venturi Mask. Like you can have a blue color, you can have an orange color, green color, we have a white color. And so according to the color coding, we can fix the demand, or we can have the fixed concentration of oxygen. So like if you are using a blue color of Venturi Mask, so with the help of that blue color device, you can give 2 liters oxygen per minute. With the white you can give 4 liters per minute. With orange you can give 6 liters. With yellow you can give 8 liters, and so on. So we have the last is that green. With this you can give 60% oxygen, that is up to 15 liters of oxygen you can fix and you can give. What is the advantage of using the Venturi Mask? When we are using a Venturi Mask, you can just fix the liter of oxygen. Like if you are using 15 liter green color, so you can adjust it on 15 liter and the patient will get the continuous supply of 15 liter for those times. So after Venturi Mask, you can have another method, that is known as phase tent method. With this method, you can give again 8 to 15 liter of oxygen per minute. And after the phase tent, we can use a T-piece. T-piece, you can directly apply it to the patient side, and you can give around 8 to 10 or approx 15 liter of oxygen per minute again. After the T-piece, you can directly go with the non-invasive as well as the invasive methods of oxygen administration. The non-invasive methods are your BiPAP, your CPAP, and the invasive methods are your tracheostomy or your ET intubation. Whenever we are doing ET intubation or tracheostomy, you can need a reservoir, that is known as ambu bag. So ambu bag is required to give oxygen at that time. With the help of ambu bag, you can give 100% oxygen. These are the different methods of giving oxygen by various appliances. Now we have certain nursing consideration whenever you are giving oxygen to a patient. So we have a few points that should be keep in mind whenever we are giving oxygen to a patient. Number one thing, always check for the oxygen source. Any leakage is there, or any you have to check for the leakage in the oxygen source. Smoking mask. Always switch off the fans whenever you are giving oxygen to your patient, and always have a no smoking sign near your patient, and explain your patient as well as the relatives also. So for no smoking, because oxygen is a very good source of fire and combustion. So whenever there is any chances of fire or any spark, oxygen will definitely catch that fire. So please tell your patient as well as relative for no smoking also. And very important to document also. Whenever you are giving oxygen with any of the method, document at what liter you are giving and at what method you are giving oxygen to your patient. Very important, oxygen we can give as a lifesaver. So as a nurse, every time it doesn't require that your doctor is telling you have to give oxygen. If you are thinking or you are checking the SpO2 values and you are thinking, is it necessary for your patient to give oxygen, anytime you can connect oxygen source to your patient with your knowledge and wisdom also. So that's all for oxygen administration and oxygen inhalation.